Assalamu alaikum. Dr. Hussain Bashkolachi YouTube channel is with you, and today we will touch vaccines and vaccine preventable diseases. As per the Lancet data of 2024, 50 years of the expanded program on immunization started in 1974. 150 million lives uh, have been saved and 40% reduction in the global infant mortality rate from the 14th major infections or pathogens. So this is the state of affair that the vaccines are important, and this is published in the Lancet. And the same is that almost vaccine preventable disease, as per my information, 17% diseases, communicable diseases, are related to the vaccine preventable diseases. Even hepatitis B prevents the cancer, and HPV vaccine also prevents the cervical cancer. So the expanded program on immunization in 2021 was changed from expanded program of immunization to essential program on immunization, because it was started with the six vaccines, and now almost 12 vaccines are in Pakistan, and almost 20 vaccines are in the world. Once in a program, I heard an expert from Bangladesh that in USA, at that time we were using 5, 6 vaccine, and the USA was using 19 vaccines, and vaccine hesitancy and number of vaccines and number of health visits, they were considered a cumbersome exercise, and even 6 visits are important in Pakistan to complete the EPI schedule. Now the EPI expanded program word is now converted into an essential program on immunization. So the postgraduate students can be asked that what is the difference between uh, expanded program of immunization and essential program of immunization. The expanded program was immunization was started in 1974, and the essential program on immunization, because of lot of changes in the vaccines, number of vaccines, as well as the new methods of research and transportation. Now this is changed from expanded program to essential program on immunization in 1921, and WHO website is giving information I will share with you just now after sharing the my presentation, so that you can understand better. So hopefully this is a presentation, and you can see the cold chain system, cold chain elements, EPI schedule, MR vaccine, HPV vaccine, and essential program on immunization. So this is important, and my YouTube channel link is there, Dr. Hussain Bashkolachi, 6343, and you can find many videos on public health and other related health and development issues. So this is a reference, and you can link and WHO and the international and immunization HTTPS. So essential program on immunization you will find on this link. Then the expanded program on immunization launched by the WHO in 1974 has evolved into essential program on immunization, while expanded initially focused on expanding 6 initial vaccines. Essential reflects a modern, comprehensive, and sustained approach incorporating the broader vaccine schedules and integrating with overall primary health care to combat vaccine preventable diseases. WHO 2021 to 2023 is working on this program. Uh, Further, it says that essential program on immunization aims to strengthen vaccine program supply, delivery, and ensure universal access to all relevant vaccines for all population across the life course. This picture shows you the role of vaccine, particularly at the national level. We will discuss more in the coming. So, supply chain and logistic. Despite the success of routine immunization program, national vaccine supply chains are under increasing pressure to effectively manage the surge of new vaccine. Surge of new vaccine means increase of the new vaccine introduction, adapt to needs of new delivery strategies, and benefits from new technological advances in cold chain. Even now, the solar energy is utilized in most of the facilities, and you will find that at the rooftop of every building in the Pakistan and in where the sunlight is more, uh, people are using this technology, wind technology, and many other uh, batteries, and so on and so forth. Pressure to increase performance is pushing the limits of what can be achieved. So, this was the aim, and let us further see the Immunization Agenda 2030 sets an ambitious, these are the paragraphs I have taken from the Essential Program on Immunization from the website I have mentioned earlier, and you can verify it and connect it. Overarching global vision and strategy for vaccines and immunization for the decade 2021 to 2030. This is also the period where SDG, Sustainable Development Goals, are also uh, coined and also promoted by the United Nations. So WHO, United Nations are thinking eye to eye because goal 3, good health and well-being, will require vaccines, and supply chain and logistics is a key area of focus in the first overarching strategic priority to ensure that immunization programs are an integral part of primary health care to achieve universal health coverage. So let us move further. The Immunization Agenda 2030 sets an ambitious overarching global vision and strategy for vaccine immunization for decade 2021. I have already mentioned, and supply chain and logistic is the key area. Strengthening supply chain to ensure that high quality vaccine. High quality vaccine is the important word, are always available in the right quantity and from farm, right quantity and farm at the right time in the right place and stored and distributed under the right condition. So means proper conditions, promote integration with other supply chains for more effective delivery of primary health care. Primary health care is a major program of the WHO started in 1978, and then again it was renamed as the Universal Coverage UHC. Uh, so that is also important with invest in systems and infrastructure to safely manage, treat, and dispose of vaccine waste to help reduce the environmental footprint. So, the disposal of the vaccine is also one of the important because the preservative, even the glass pieces, the plastic coverage, and something is important. So, let us see more about the immunization in Pakistan, which is important. You can see that in this chart you will find the clear marking, but later I should show you more important. So 1976, the immunization program was started with six pathogen or six vaccines against them. Then again in 1978, expanded program on immunization was started by the WHO, and then in 94 other vaccines, 2000 to 9 to 15 to 1920, these vaccines were added. So now we have 12 vaccines, and if the detail is there, I will show you. You can see that this is a vaccine schedule up to the 5 years. The 12 vaccine program is now in Pakistan, and even for measles, rubella, the age is even up to more than that, but within 5 years, these vaccines are completed. So these are the schedules. You can see if they are clearly mentioned. But here in Urdu, you can see that vaccine schedule by 2025, and you can see that Sehatmand and Khushhal Muashara. Okay, so now the One Health is also important. The vaccine program on the human side is also important, and vaccine program on the animal side, because most of the infections are there. So let us discuss the vaccine chain. And you can see that the cold chain is important. And the word is asked what is cold chain. You can see that it starts from the international airports and reaches to the end user or to the children. This is more clear, and you can see that the national store, sub-national store, district store, service delivery point, and vaccine administration. Then waste management, daily record, monthly reports, and monthly analysis and request for the more supply. So this is the entire cold chain program. What is the definition of the cold chain? The cold chain is the system of transporting and storing vaccine at recommended temperature from the point of manufacture to the point of use. And you can see the client is at the bottom, and the manufacturer, then distributor, then depot, provider, office, so on and so forth. So with this, I will show you some pictures. This is the temperature. Normally it is 0 to 8, but it is sometime mentioned on the vaccine profile or the vaccine manufacturer. This is a box carrying with a cold ice packs, and we call it the ice pack or the vaccine carrier, and it can be carried by the vaccinator to the point of delivery or towards village from the center, or even in the immunization campaigns to the periphery. So it keeps the vaccine potent, and it keeps the, and this shows that the cold chain system is the system of ensuring vaccine are kept potent from the point of manufacturing to the point of administration and stored at the correct temperature. This is another picture. You can see that how the cold chain works, and even these are the from the main cold chain to the carrier, and this is how you have to keep clean, and you have to reduce the wastage as well as maintain the temperature. Proper deforesting of the refrigerator is important, and checking, we will show you that twice at least is important, and these are the thermometers used in the vaccine, and this is the monitoring. twice daily, 7 day a week, including weekends and holidays. Temperature reading should be recorded in a standard record form. Data must be analyzed. So this is the chart on which you have to mention the temperature, uh, the weekly as well as monthly as per the guideline of the. So these are the monitoring the charts instruction. Record the name of the staff responsible for reading the temperature. Record other information. Read the temperature first in the morning and put a dot at the leftmost part of the line. So with this, we are concluding, but let us see that in Pakistan, 12 vaccines are there, and 0 to 1 year, uh, 0 to 5 years. And this is, you can see that the vaccines, last vaccine is MR, which is my more interest. This is measles and rubella vaccine, and that is given at the 9 month and 15 month. So in the 5 age, 6 visits are necessary to complete, and one vaccine is the combined vaccine, Penta vaccine, which is given after 6 weeks, and polio and hepatitis. Polio is given at birth, and even the mother is if positive from the hepatitis B, that is also added there. And in Penta, we have 5 vaccines in which diphtheria, tetanus, pertussis, as well as the hepatitis Haemophilus influenza and hepatitis B. These are. And then we have also pneumococcal vaccine and typhoid vaccine, rota vaccine. So these combined are almost the 12 vaccines. And with this, you can see that EPI program in Pakistan was started in 1978. I have once again mentioned that 154 million deaths have been averted by the EPI program, and 50% mortality rate has been reduced by the EPI vaccine on the 1 year old children. So, vaccine, I normally say, is a gift of the health department, and any child who is not given this gift, and this is the gift of health, development, growth, happiness, and long life, and continuity of our next generation. Thank you very much. With this, I am ending this lecture. So I hope you will you have learned something new, and particularly the expanded program on immunization is converted into essential program on immunization, and universal health coverage is the new name of the primary health care, as well as vaccine preventable diseases are cost effective, and one death prevented by the vaccine is considered adding 66 years of life to the national average or the life expectancy at the global level or national level. Thank you very much, Dr. Hussain Bashkolachi. YouTube channel will provide you the latest information. Thank you.